Hello, everyone, and welcome to this audio podcast. My name's Shahid Nazir Mohammed, and on behalf of the RPSG, the Renal Patient Support Group, the RPSG, um, uh, on behalf of the RPSG, sorry, to today looking at a sort of collaborative research poster presentation that had been presented at the NIHR National Institute of Health Research, or NIHR Involve seminar, which took place in 2014, and the sort of remit was in around Involve 2014 and changing landscapes. And this research poster presentation was collaborative between the between an academic institution in the United Kingdom, and also the RPSG, and also wherein one of the collaborators had sort of had a basis in around the RPSG, as well as the academic institution in the United Kingdom. So this research poster presentation actually looks at the theme in around development and learning, and the use of social media for people with long-term conditions or long-standing conditions to facilitate learning in higher education, and looks at this from a chronic kidney disease or CKD perspective. So the aims of this works was where the aims of this works really was to introduce and evaluate a sort of inventive patient involvement project in amongst an academic setting, and secondly, where the objectives were to number one, firstly, sorry, the objectives were firstly to utilize sort of anonymous patient to patient discussions that took place through the RPSG. Secondly, to facilitate learning for second year student nurses are on an undergraduate program by highlighting the awareness and importance of the patient perspective on hemodialysis, on a form of on hemodialysis being a form of KRT, or kidney replacement therapy, and looking at vascular access care. Before going into the introduction, our listeners and viewers are to iterate or to highlight or inform that the vascular access care aspect is where one of the collaborators of this works initiated an awareness sorry a vascular awareness sort of kit for those who were to be initiated on hemodialysis treatment or hemodialysis kidney replacement therapy, and where the vascular access kit would be basic 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 sort of consumables, if you like, wherein a newly initiated hemodialysis recipients would use the sort of consumables as a way to raise awareness around vascular access, but also to inform, for example, where health professionals look to cannulate to access to cannulate to get blood samples, for example, that the awareness around vascular access was such that health professionals were to be informed that the vascular access point was not to be was a basis where blood samples, for example, were not to be taken from. So as part of the background, as part of the background, in the last or past decade or so, the use of tech, including social media, in healthcare has changed dramatically. The use of social media, such as Facebook, for example, as perhaps one of the initial social media platforms, is often used is or has often been used to provide to provide and support for people, to provide support, a supportive basis for people with long-term or long-standing conditions. Um, Chronic kidney disease (CKD) is a long-standing or long-term condition, and people who have severe end-stage kidney disease, or ESKD, require kidney replacement therapy, or KRT, in the form of dialysis or hemodialysis, through an artificial kidney, and where an artificial kidney is from a kidney machine, which requires sort of where where vas- require which requires sort of vascular access, and this vascular access where this vascular access is a surgical procedure which prompts sort of surgeons to which prompts sorry vascular surgeons, for example, to anastomose a vein and an artery to increase blood flow, and where this blood flow sorry where this anastomose where the anastomose is a surgical sort of a surgical terminology, or clinical or medical terminology, that is for patients where there has been a surgical link, a sort of surgical link between an artery and a vein, to allow appropriate cannulation for KRT, in the form of hemodialysis, to take place. So now, around the RPSG, the RPSG, the Renal Patient Support Group, has been supporting healthcare service users and carers, for example, healthcare service users, carers, and healthcare professionals, who are in and around aspects surrounding in around in around in around aspects pertaining to kidney care, sort of since in around 2009. The RPSG, sort of additionally, at the time of this particular research poster being this research poster presentation, which had been presented at NIHR Involve in 2014, had over 3,000 virtual virtual members globally, or across the world. So this sort of small investigation, if you like, this small investigation was contemporary, in that it utilized social media, or the a closed social media a closed Facebook group, a closed Facebook group, to recruit patient and carer participants, support data collect and in order to support some data collection, the RPSG provides the RPSG platform or social media platform provides a sort of provides sort of flexibility for its for its for it for the use for you for its users for its users, and at the same time the the uh, the flexibility for its users has allowed and encouraged sort of participant or patient and public involvement in regard to kidney or renal related projects. And so this works was had this works was novel in was a novel way to raise awareness on vascular access, and to collect some baseline data. And the works was one of the first sort of investigations through the RPSG social media platform. So now looking at sort of looking at looking at using social media leadership and gaps in healthcare, gaps in aspects of healthcare, um, aspects of healthcare before going into aspects around the methodology around this works. So there are a number of publications that have highlighted the use of using methodologies, that highlighted the use of using online methodologies to collect research data and the internet, and through the World Wide Web as a source for healthcare information and patient or healthcare service user empowerment. Um, some publications in this regard go back to around 2000, go back to around 2005 to 2009. Works by, for example, Armstrong and Powell in 2009, and works by Atrija and team in 2005, and G and G also in 2009. So, having conducted some background sort of literature works, and sort of where one of the main collaborators in this works had been involved in raising vascular access awareness since in around 2011. It was apparent that there were gaps in aspects around healthcare and education, and this was evident through aspects around observations, personal experiences, and understanding concerns raised from fellow healthcare service users. Uh, at the same time, where one of the collaborators in around this works attended a renal center patient leadership course, paved the way for initial thoughts and interaction on how to potentially structure parts of the project and awareness campaign, and also provided potential ideas to disseminate our findings more broadly. So now looking at the methodology around this research poster presentation. So the fistula access project. So to iterate again, listeners and viewers, the fistula is a clinical terminology that is that is used as a way to that is used as a way to describe the anastomosis, the joining of the artery and the vein, and where, for example, those on forms of hemodialysis or kidney replacement therapy that are on forms of kidney replacement therapy or KRT are are asked by healthcare professionals within uh, within uh, within for example, hemodialysis in hemodialysis hospitals, hemodialysis hospital centers, for example, for example, if they have access, if they have vascular access, if they have a fistula access, for example. So this fistula access project or awareness campaign began with a few basic questions. So number one, what were you told by the vascular team about the care of your arm? Now, before going on, listeners and viewer, the vascular access or anastomosis, by default is normally a surgical procedure that is that is that is that is that is carried out by surgical teams, mainly on the non-dominant arm of healthcare service users who require hemodialysis, for example. Um, so again, one of the first questions is a part of this as part of this works was, what were you told about told by the vascular team about the care of your arm before and after your fistula procedure? Secondly, what were your concerns after the procedure? Thirdly, did your pre-dialysis or hemodialysis team offer you any information? Fourthly, what support were you offered, if any? And fifth, were you made aware of fistula awareness bans to alert health professionals to not use your fistula arm for example, blood pressure, for arterial blood pressure monitoring or cannulation? Six, were the fistula awareness bans easy to locate? Number seven, have you been in a situation where you felt vulnerable enough that you were wearing a fistula awareness band in or outside of the hospital of the hospital environment? Eight, did wearing a fistula awareness band uh, make uh, make you feel comfortable? Nine, what action did you take to protect your fistula? Number 10, have you had any damage to your fistula? 11, what effect did this have on you? 12, do you see your fistula issues being more psychological or physical? 13, 13, do you feel more continual professional development or CPD is required? So these questions formed a thread that was initially posted on the RPSG between around 2000 in around between December 2013 and January 2014. RPSG members or healthcare service users and carers as well were invited to post to post comments on vascular access experiences in order to collect data on main concerns. In addition, in addition to the RPSG social media platform, the collaborator, one of the main collaborators in this works, also have posted questions on three renal or kidney related social media platforms, again on social media platforms or groups on Facebook, on Facebook, additionally, which were also used an approach to help support and promote this particular this project, was part of the main collaborators sort of campaign. Um, Main collaborators or works or campaign, and again with the same questions. And the social media platforms also included the dialysis discussion uncensored group, the living with polycystic kidney disease group, and the kidney disease and diet helps group during the same time. The thread on all groups or on the thread on all groups or on platforms were monitored and managed by the RPSG and an honorary researcher. Comments were then anonymized and forwarded onto a collaborator at the academic institution to be used in a classroom setting to in a classroom setting wherein the data was used in and as part of as for in and as part of second and third year um, second and third year nursing students in an academic institution in the United Kingdom. So now to highlight some of the comments from this works. So the project awareness campaign had received just under 200 posts, 180 posts between four social media platforms, being on and primarily on Facebook. And the posts that formed as part of this research poster presentation, were primarily from the RPSG and not from the additional social media platforms. So firstly, the professionals did not. So one of the comments was the professionals need to be made aware, as they won't see these fistula as they won't see these bands of fistula very often. Secondly, must be honest, I was given one of these, and where the participant, or where the where the participant is referring to a fistula band, and this band being like a wristband that is over the non-dominant arm, or where the fistula where the anastomosis of fistula is and was. And where the participant said, must be honest, I was given one of these by the pre-dialysis or hemodialysis team when the fistula was constructed, and I think they're really a really good idea. They're a really good idea. Thirdly, I think you should should get given them. I have been admitted to another hospital, and I have had doctors and nurses adamant that they are using my arm, despite telling them telling them I have, despite telling them I have a fistula. Fourthly, comment number four was these bracelets, or referring to these wristbands, are a brill idea. Um, and number five, I worry that I might not be able to speak, and they may use sorry, and they use my arm, so thank you again. And where the one of the collaborators has one of the comments was that one of the collaborator or the collaborator uh, had where one of the comments referred to the collaborator and said that us renal patients or kidney patients need all the help we can get. And um, comment number six, something else I've talked about is a sleeve to cover the fistula during ops being a short terminology for operations. As If you read some of the comments, like myself, all manner of things have been used. It's all about us uh, being vulnerable and keeping our fistula safe at the end of the day. And so it's and so as it's so important. Comment number seven was I was shocked at the number of times I had to I had to tell nursing staff to take blood, to take blood or take arterial blood pressure from my right arm, I as I had the fistula on the left. Comment number eight was I have just spent 3 days, 3 days in my local hospital, during which time I was in A and E, three different wards, none of them being kidney or none of them being renal, and in all of these, the staff noticed my armband, and said that they thought it was a good idea. Hopefully, if more of our fellow patients wore one of wore one any accidental use if one of sorry hopefully if more of our fellow patients wore one, any accidental use can be avoided. Comment number nine was what I would like to add, please, though, is more training for staff, as most are keen to learn and praise me for wearing, and they have maybe they have maybe been told in training, but some have not. So more needs to be done. The vulnerable are the biggest concern, but then we are all vulnerable. Not everyone wants to shout out like I did. And comment number 10, and it was the final comment in as part of this research presentation, as part of the data collection. I was thinking that they could even maybe do one for patients on peritoneal dialysis. Peritoneal dialysis, I know it's not as much as not as much as a pain as hemodialysis, but I think it always helps to have an easy way for NHS National Health Service staff to see if a patient has something the same with transplants. So now looking at sort of the analysis, some of the analysis. So the RPSG, the Renal Patient Support Group, received 112 comments, 112 comments, and 30 plus likes. The dialysis discussion uncensored group had received 43 comments and 30 plus likes, and the living with polycystic kidney disease group received 30 comments and 10 likes, and the kidney disease and diet health group received 22 comments and 10 plus likes. The analysis helped derive four main themes. Number four main themes. Um, First theme being patient psychology. Second being empowerment. Thirdly being education and understanding, and fourth being awareness. Looking at sort of the teaching student nurses and evaluation aspect, there were about 200 student nurses who attended a teaching session at the academic institution. At the academic institution, all interested or intrigued in the work of the RPSG. All had good ideas for increasing awareness, including firstly the wristbands, secondly a question on admission sheets that prompts staff to ask if a patient has a fistula, and thirdly where renal nurses or kidney nurses educating general nurses about fistula care. Students suggested that students suggested sort of generally that national campaign website to look for to seek out funding support would be advantageous. So now looking at the summary around this work. So Facebook as a social media platform allows a good general basis for people to interact. It appeals to all audiences. The RPSG supported and promoted this project and awareness campaign, and the group the social media the RPSG platform raises CKD or chronic kidney disease awareness at all stages. Fistula access plays a massive part in the world of CKD. Awareness and care should be a valued concern for healthcare professionals, since it impacts on patient psychology and well-being, and this all links to coping. Healthcare professionals should strive to empower themselves more, and staff generally need to have empathy, understanding, and knowledge that fistula care needs to be taken more seriously, and not just in the kidney specialty, but across all healthcare specialties, since patients can have a number of clinical complications. Healthcare professionals should form partnerships with patients for a better understanding of fistula care and educational outcomes. More broadly, a fistula brand should be available for patients on hemodialysis, and these should be as part of a patient's care plan. A few kidney patient associations or KPAs offer fistula brands for free, whilst others have them for sale to help raise funds. Um, and then patients also need to empower themselves to ensure that they are aware of how care should be how care should be received. In regard to some prospective works, now the prospective works in around this is prospective works that one of the lead collaborators had looked to sort of follow on had looked to follow on and so to highlight some of the prospective works in around and following this research poster presentation. So more educational continuous professional development that needs to take place for healthcare staff to reflect and self-evaluate upon how to better practice, reflecting reflecting plan to attend. There was a reflection where there was a plan to attend a National Health Service (NHS) Leadership Academy, a leadership NHS Leadership Academy seminar to be to to become a sort of a leader on as part of the initiative. Um, Secondly, fistula awareness sort of kits to become broadly available and to include one fistula wristbands or bands to wear around the wrist. Secondly, information leaflet about the use of the wristbands. Thirdly, dressings for use in emergencies. Fourthly, sort of an ID wallet-sized card which helps to highlight patient has a fistula access point. And fifthly, to provide information that can be worn around the neck, for example. And Additionally, sort of further awareness has taken place through personal stories in local newspapers, and again, where one of the lead collaborators in and around this works had followed on, and the one of the NHS trusts that the lead collaborator had discussions and dialoguing around. Have been in the process of piloting a fistula awareness kit. So some conclusions. The feedback from the RPSG. From the RPSG highlighted that all healthcare professionals need to gain a better understanding of hemodialysis access for CKD patients. Secondly, the use of social media for people with CKD has allowed again a sort of robust number of comments to be collated and facilitated for learning and teaching nurse students in higher education. Uh, Thirdly, patients need to take more control of healthcare plans so that any issues can be raised immediately to avoid psychological distress. Fifthly, fistula care or fistula access care is of high importance to all patients, and some of the comments highlighted here inform of experiences. Six, fistula ban, a fistula ban or kid, a fistula band is perhaps important relating to awareness and identification. Some patients or healthcare service users who commented view the band as a sort of comfort blanket. And seven, this was a novel collaboration. It was a novel collaboration between an academic institution and the social media the social media platform, and raising awareness and research. Is an important essence of the RPSG, and the RPSG generally is a social media platform that has been known to be a place where awareness meets research. Thank you for listening. That is the end of the overview of this research poster presentation. Which looked at the use of social media for people with long-term conditions to facilitate learning in higher education, and looking at a CKD or chronic kidney disease perspective. The research poster presentation was presented at the Involve seminar in 2014, where the theme was changing landscapes. Thank you.